statistics from our facts and figures, just to kind of show the numbers that we're talking about, and then we're going to move into the workplace impacts. The fact that in the United States, more than 6 million Americans are living with Alzheimer's disease. Over 11 million Americans provide unpaid care for people with Alzheimer's and other progressive dementias, and that these caregivers provide an estimated 15.3 billion hours of care, valued at nearly 257 billion. These are from our latest facts and figures that were just released in March. And from a Connecticut perspective, 80,000 people age 65 or older, we're going to address under 65 later, but age 65 or older, 80,000 people living with Alzheimer's disease. 142,000 caregivers providing unpaid care for people with Alzheimer's and other progressive dementias. And these caregivers are providing an estimated 156 million hours of unpaid care, valued at 2.8 billion. 47% of the caregivers report chronic health conditions, and 17.6% reporting depression. It's interesting because when we would do programs, I've done a lot of family caregiver programs, and we'll talk about caregiver health, and people will say to me, do you take your own advice? And when you're in the midst of that caregiving, it's not necessarily as easy to take your own advice. And often care partners, caregivers are making sure that their loved one with dementias, their care needs are met, but not necessarily getting to the doctors themselves. Okay. This once, we're going to talk a little bit about the cost of, wait a minute, this looks like it, okay, it skipped a little, very good. So the cost of dementia to US businesses, this statistic is older, but it's the best statistic that I could find, and it's from a June report in 2002. There was a gentleman from the University of Pennsylvania that did some extensive research, and it talks about the cost to American businesses of $61 billion per year. And I know we have folks in insurance that are in this call today, but 24.5 billion in costs of healthcare for people with Alzheimer's disease and other dementias. And then the other 36.5 billion related to employees providing care, and the costs related to absenteeism. And he has the approximate numbers related to that, 10 billion. Productivity losses, 18 billion, including even like, interruptions to work, and replacement costs for caregivers leaving employment because of their caregiver responsibilities. We have definitely gotten calls on our helpline for people that have done that. They feel like, how else can we do this? And they leave, and then like, now what do we do? And then the employer has the replacement of those employees in the workforce. Okay. Employees who do remain in the workplace but are working at less than full productivity with interruptions, they're actually a bigger problem, a bigger cost than the absenteeism for employers. And even though we are going to, after this slide, we're going to start talking about a little bit about people with dementia in the workplace, the main impact of Alzheimer's and other dementias is this burden on employees who are also informal or unpaid caregivers. Many caregivers who contact our helpline, who I've spoken with over the years, and myself included, it was a 20-year period. Probably the hardest thing that I've ever done in my life or will ever do in my life was providing care for parents, but also could be spouses with Alzheimer's and other dementias. And also trying to do that while balancing work, very difficult balance, which caregivers often struggle with. Okay. Talk a little bit about risk factors, and this is just one, but in all of our other programming that we would normally deliver, age is listed as the greatest risk factor of Alzheimer's disease. But the fact that Alzheimer's and other progressive dementias are not normal aging. And the reason why that is said is that after age 65, the risk of Alzheimer's doubles every 5 years. And in terms of workplace, as people work longer or perhaps retire at an older age, there's a greater risk of Alzheimer's in the workplace. Okay. This slide, we're going to talk a little bit about younger onset dementia. It refers to people who have symptoms of Alzheimer's and other dementias prior to age 65. It used to be called, and sometimes still is called, early onset dementia, but there's a lot of confusion because when we talk about the stages of Alzheimer's and other dementias, we talk about early stage. So I would sometimes get, and I still do get, phone calls where someone will say, you know, my spouse, my parent has early onset dementia. So if I ask the age of that person, I will sometimes hear they're 90. Okay, so there's that confusion between early onset and early stage, which is why the Alzheimer's Association is trying to move to that younger onset term to avoid some of that confusion. And this next statistic, frankly, since I don't deliver this a lot, I've been doing a lot of reading of things all over the place, pulling together numbers. And approximately 5% of people with dementia have a younger onset diagnosis. But depending on what you look at, that number varies. I've seen 5 to 6%. Mayo Clinic had 8%. You know, certainly it's a lesser percentage than people that are over 65, but around 5% is a fair estimate of the number of people with a younger onset diagnosis. And the fact that, and I know all of you on this call are aware of this, that people are diagnosed, it could be in their 50s, it may be in their 40s, it could be in their 30s, and rarely even younger. Years ago, when I was able to go to Boston for a seminar in between when my mom had passed and my dad was still early on, pretty, you know, good. There was a geneticist from Boston who said he actually had a 20-year-old, someone in their early 20s coming in with young children diagnosed with a younger onset dementia. You know, it's very rare, but it does happen. And the thing with younger onset, as you all know, is that there's unique challenges related to, you know, family, work, finances, and future care. When someone, you know, in the workplace, you know, has a 9-year-old, and, you know, how do I tell my 9-year-old that I have this? You know, how do I even communicate that information? One gentleman who happened to be a neighbor of mine, I didn't know him very well since I was immersed in caring for my mom, but he actually faxed a letter to our Connecticut office, again, diagnosed in his early 50s. He's a self-employed architect. And he said, I helped to pay for my son's college education, but now I have this, and I'm not going to be able to help to pay for my daughter's. So Alzheimer's Association, will you help to pay for my daughter's college education? So things that maybe people diagnosed later in life, some of the challenges that you'll see in a younger onset family are very, very different and especially difficult. Oops. Okay, so some common causes of younger onset dementias, and I did put this in because there are people, and I'll have some examples that are in the workforce where this happens. So again, symptoms can appear as young as the 30s or 40s with a younger onset Alzheimer's disease. Frontal temporal dementias, symptoms can appear as young as people in their 20s, and as frontal temporal dementias are less common in people over age 65. So there are quite a few people that connect with us that have a younger onset frontal temporal dementia. And then Lewy body dementia can occur in younger people, but is most common over age 65. I got a call last week regarding someone with a younger onset Lewy body dementia. Is there questions, or you want me to continue? Okay, so this just talks a little bit, and again, for a short presentation, we can only go into a certain level of detail, but what if someone observes significant changes in cognition and job performance? The first thing is, it's similar to when we talk about our 10 warning signs presentation, which we have done as employee lunch and learns, et cetera, that there are many possible causes of the cognitive changes. Is it stress? Is it depression? Is it a physical illness? Is it a new medication, nutritional deficiency, untreated thyroid disorder, chemotherapy for cancer treatment, progressive dementia? So seeing things that are changes in someone doesn't guarantee that it's a dementia, but it's part of that equation. Okay. And then this slide talks about what possible changes we might observe in job performance of a person, perhaps that has dementia. Is there increasing frustration on the job? Is the person having difficulty, getting information, storing information? Is it taking someone a much, much, much longer time to do their job? My brother there's a thing called To Whom I May Concern. And it's usually people with an early onset dementia that will do presentations and help to raise awareness. And there was a gentleman on that panel that he said, it took me longer to do my job. So we're in the midst of caregiving. My brother came to visit. He goes, Maria, it takes me longer to do my job. I said, Rich, as we age, it might take us a little longer to do our job. But if it takes us much, much, much longer, it's something that's more concerning. Difficulty learning new things, which is, again, not unusual for an early stage Alzheimer's, but again, could there be the other physical causes? Difficulty paying attention, starting or stopping tasks. Changes in organization, judgment, reasoning, setting time, goals, plans. And what could that look like? Is there someone that has never missed deadlines and they're missing deadlines? Is there someone that's not showing up for meetings? Are they showing up late? Are they saying that we never told them something that we know that we've shared? Are there changes in personality? And again, from the first slide, we know that these things are not always caused by a dementia, but certainly could be how dementias are presenting in the workplace. This is interesting because, and I have a few, again, examples that I'll share in a little while. The fact that some people with dementia do have an awareness of changes, others do not. And some people, even if they do have an awareness, are there impacts of stigma, or are they afraid of losing their job, and are there reasons that they may not share? Okay. So this talks briefly about some possible next steps, conducting, again, if there are performance changes, conducting a safety assessment. If people are in certain positions, if they're working in, in law enforcement, if they're working in a factory where they're building parts for things, where there could be major safety concerns. Having a conversation, focus on the performance, not confrontation, not talking about a dementia diagnosis. That's not the role of a manager. Keeping records of the changes. And then again, if someone does disclose a cognitive impairment, considering reasonable accommodations. And it just lists here, and I am not an expert, but that for ADA, employers with 15 or more employees are required to explore reasonable accommodations that can be provided to help the person. Adjusting job functions for people's strengths. I have an example on the next page. We'll share that, and perhaps providing those reasonable accommodations. So these are some real examples and from the workplace. Home care nurse in his early 50s who was aware of some clerical errors and was so fearful of making an error with medication that he resigned his position. And he was eventually diagnosed with a frontal temporal dementia. A nurse supervisor in a mental health facility, late 40s, who was not aware of cognitive changes and was terminated from his position due to job performance. He was eventually diagnosed with a younger onset Alzheimer's disease. This next one was interesting. It was a care consultation. It was many years ago, but it always stayed in my mind. It was she was a grocery store cash department head, approximately 65, who was starting to struggle on the job, and she was aware of changes and was diagnosed with Alzheimer's type dementia and communicated directly with her employer. And the company communicated with her, and they followed her lead as her dementia progressed, capitalizing on her strengths. And so she was a cashier, she was a cash department head, and when she couldn't do that, they said, "What do you want to do?" And she said, "I think I can be a cashier." And she was a cashier for quite some time. And then dementia progressed again, and they said, "What do you want to do?" And she said, "I think I want to be a bagger. Can I do that?" And they said, "Yes." So they worked with her, capitalizing on her strengths until she eventually did have to leave the organization. And this last one was a high school teacher, early 50s, whose coworkers noticed issues with scheduling and interactions. And they talked to her because they were her friends, and she did seek a diagnosis and was diagnosed with younger onset Alzheimer's disease. So they're real examples, and in the workplace, but also turning the lives of these families upside down in many ways. So a little bit about family caregivers, which we talked about was a huge impact to employers. So 6 in 10 family caregivers of people with dementia are employed. These individuals work an average of 35 hours per week while caregiving, and approximately 57% work full-time. And caregivers of people with Alzheimer's or the dementias who had been employed at any time since they began caregiving reported certain workplace impacts that we're going to look at. So 50% of caregivers of people with a dementia needed to go in late, leave early, or take time off due to their caregiver responsibilities. And that compares to about 47% for caregivers of people with other conditions. Okay, so these next ones kind of give a comparison, because we know that people care for people with a lot of different conditions, which certainly have similar impacts. 18% of caregivers reduced work hours compared to 13% of other caregivers. 16% of caregivers, people with dementia, took a leave of absence compared to 14%. And 9% just left the workforce compared to 5% for other caregivers. So there's definitely impacts for people that are caring for people with Alzheimer's and dementias. And you guys know the unpredictability of a lot of things that happen with Alzheimer's and dementia, the progressive nature, contribute to some of the stressors on caregivers. 75% of caregivers are concerned about maintaining their own health since becoming a caregiver. Many people that I've worked with in support groups, they, again, were focused on caring for their loved ones, and just in the juggling of everything, necessarily didn't look at their own health during that period of time. Almost 60% report high to very high emotional stress, and almost 40% report high to very high physical stress. The average dementia caregiver will provide care for 4 to 8 years, but that span can be as long as 15 or 20 years. And data points to a longer duration than caregivers of people with other conditions, 79% to 66%. And that high emotional stress can just be especially exhausting for caregivers. I know, trying to balance everything, wanting to do right, some not aware of resources. That's why we so appreciate this opportunity to at least raise awareness in some way. How do we keep employees with caregiver responsibilities in the workplace? Increasing awareness with education and communication. And then again, every company is different, every person with dementia is different, but supports for family caregivers, like what can they look like? Are flexible work options possible? Is part-time work possible? One of the things I did do in my previous employer is, I realized that full-time was a challenge. So my first step was to go part-time. Certainly it wasn't the total answer, but it helped. Local resources, family leave, health insurance, flexible spending arrangements, stress reduction programs, caregiver support groups. So, and it may be, just letting people know through an EAP that these kinds of services exist, different things like that. Okay. So some workplace examples. This was a caregiver for one parent with Alzheimer's type dementia, one with mild cognitive impairment, who was trying to balance caregiver role in a corporate training at a major insurance company, declined the regional training opportunity, decreased work hours to part-time. Caregiver eventually resigned position and took a more flexible position outside the organization, initially with a $60,000 pay cut. So it's affecting people financially as well as the other impacts. Another caregiver who quit a job to care full-time for a parent with a progressive dementia and is now facing financial difficulties, including loss of health insurance. One caregiver took a leave of absence from her position as a teacher to actively care and advocate for her husband with a younger onset Alzheimer's disease. And this last one is a caregiver of a spouse with late stage frontal temporal dementia, for 15 years. She's been working remotely due to the pandemic, and she's now planning for in-home care several days per week since return to office is under discussion by her employer. Her husband had been attending an adult day center prior to the pandemic, but this is no longer an option. So, and she's been under tremendous emotional stress for years. Her example brings up, every once in a while when we've done caregiver programs that Deborah referenced, I've had caregivers as speakers, professional people as speakers. And one woman said very early in my journey with the Alzheimer's Association that she had always thought as a professional in the field that she knew everything there was to know about Alzheimer's and other dementias until it hit her family. And then she felt like she knew nothing. And it's interesting, I was talking to a gentleman probably a couple of weeks ago, and we've talked regularly, again, a professional in the field, and, and we chat just informally, very confidentially, and he'll say, I've done this for years. Why can't I do this with my own parents? And it's different when the emotional connection in our own families makes what we all know very, very different. So I don't really even consider myself a professional because I got in this kind of a backdoor way. I was an educator, but got involved through the pain of caring for my loved ones. This last one is an adult child caregiver who finally realized that her mother needed in-home care, which is recommended by medical professionals. Her father opposed this, but she moved forward with introducing care. Her father did accept and appreciate the break. However, since he would not agree to pay for the care, the adult child paid for the in-home care for 4 years, totaling about $90,000. Not something that we normally would advise people, but this caregiver felt like, I had the one fight, I can't fight again, I'm just gonna pay for it. And these are caregivers that are then also, maybe bringing these things to the workplace, the challenges that they're facing as caregivers. Okay, and this last slide I just want to talk about is our resources through the Alzheimer's Association. The reason why we now have moved to a volunteer community educator model is that as hard as we work, we're very small staff, and many people still are not aware that we exist. I talked to a woman yesterday through a doctor referral, and she had cared for her mother who passed 2 years ago and was not aware of our services at all. So there are services on our website. Community Resource Finder is a place where people can find support groups, they can find education programs, resources. All's Connected is a social networking platform. The website Caregiver Center and Safety Center just has a lot of information for caregivers. The 24/7 helpline, it was actually something that did exist even in the beginning of my mother's journey in the late 1990s. We did call that helpline for help. Caregivers will call that number at 2 or 3 o'clock in the morning if they need supports, and it's something that in the workplace, if caregivers are aware of resources, it may help them. Right now, our programs are all virtual, but we have virtual caregiver support groups, virtual programs like awareness, 10 warning signs, understanding Alzheimer's and dementia, communication techniques, understanding responding to dementia-related behaviors, a variety of caregiver programs that can be helpful. And we also have early stage support groups, which I have later this morning, as well as early stage social engagement programs, as well as a lot of online services. And what's not on this slide is care consultations, and that is just one-on-one. It could be through the helpline, or it could be through me or other people throughout the state to just help people navigate their individual situation. Right now, virtual or telephonic, but eventually, hopefully, back in person. These services, and people asked me this the other day, do you take insurance or what's your charge? These services there is no charge for these services for family caregivers, and it's because of what Debbie and Tori mentioned earlier. The fact that we have our walks and longest day and other fundraisers that allow us to offer these services to families. We also do employee lunch and learns, things to help raise awareness in the workplace too. So I don't know if anyone has questions, and I hope this maybe helped in some small way, and we appreciate the opportunity to speak with all of you and partnering with many of you, since I know many of you on the call today. So thank you very much.